helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Patty Cheek. Today, joining me, we have Stephen Woolums from Marshall Urology at Cabell Huntington Hospital, and we are talking kidney stones. Now, they're prevalent in our area, aren't they?
Yeah, we have a very high incidence of stones. In the United States, there are certain areas that have a higher incidence than others. The true incidence of stones we really don't know for sure, but it's probably 7 to 8% of all the population. But in the southeast, and that includes Huntington, 30 to 40% of people will get stones.
Wow, and here in particular, you are doing something special in regarding all of these stones.
We do. At our Cabell Huntington Stone Center,
yes,
we not only treat the stones, but we try to be proactive and try to prevent stones from occurring in the future.
Which is a big deal in trying to get it done, because there are so many, right?
There are a lot of stones.
All right, and is it true, yeah, you said this, and how painful are stones when they pass? I hear terrible stories.
Stone pain can be some of the most excruciating pain that you have, and women who have had babies and have had stones would rather have a baby than have another stone.
No way.
Yeah, they're very, very painful.
Well, I guess the outcome of having a baby is much happier and better than having a kidney stone. I can understand that. But why do the stones, why do they cause so much pain?
Stones cause pain when they cause obstruction. Now, you can have stones in your kidneys that don't obstruct your kidneys and they don't hurt. But when they slide down and they block off the kidney, that causes the pain. And the pain continues until the obstruction is relieved.
Now, you said sometimes it doesn't hurt. Does that mean you don't even know that you have one?
Yeah, if you look at all patients across the United States, if you did CT scans, about 6 to 7% of people will have stones. Now, of those people who have the stones, if you followed them for maybe 10 years, 30 to 40% of those would have active stone disease, and that's what really hurts.
And now, we were talking about this earlier, just how you get stones, why they're caused. And I was asking, is it iced tea? Is it sodas? I mean, I hear people talking about all these different things, but when it comes down to it, what is it really?
The most common cause of stones to be formed is dehydration. Okay. Some people just don't drink enough water. However, a lot of people, they drink drinks that are dehydrating, like sodas, coffee, tea. Tea has a double whammy. It has oxalate, which is something that helps form stones, plus it's also dehydrating. So you have to look at your total urine output. The more urine output you have, the more dilute your urine is, and the less likely you are to form stones.
And I know and you got your hot tea to wake you up in the morning if you're not a coffee drinker, and so there's no winning there if you're trying to get your caffeine, I guess.
All tea is not totally bad.
Okay.
White tea, green teas, some of those can be okay.
Okay, green tea is a little safer?
It's the traditional tea that we drink in the South, sweet tea.
Yes.
You know, the black teas are the worst.
Okay, and another question that comes to mind, calcium. Is that an issue with kidney stones? Do I need to stop taking calcium? Can I continue?
That's a good question. That's a big misconception. People with calcium-based stones do not have to restrict their calcium consumption. In fact, studies show that in people with stones, that have calcium in their stones, if they reduce or restrict their calcium intake, it actually increases the risk for forming stones. So our recommendations at the Stone Center are to maintain a normal calcium intake. That will actually reduce your total risk for forming stones in the future.
Interesting how the body works. You never really, these answers are hard. And so when it comes to vegetarians, do they get kidney stones too?
Vegetarians do get kidney stones, but their risk of forming stones are less.
Now, why is that?
Well, meat is a substance, it has a substance called purines in it, and purines get converted to uric acid. Uric acid forms stones, but uric acid also affects the rest of the body and affects the composition of your acid and base balance, and that causes stones to form. So our recommendation at the Stone Center is to moderate your meat intake. Vegetarian diets are good. They're not the end all. We are America. We like to eat meat, but just moderate your meat intake.
All right, and then just finally, when do I need to get a procedure done? How is it treated, and how quickly do you need to move once you know that you have a kidney stone?
Well, the management of a stone is based upon its size and its location where it causes the obstruction. A smaller stone that is less than 10 millimeters typically can be treated with ureteroscopic extraction, which means that we go up the ureter and break the stone up with a laser beam. If a stone is very small, like less than 4 millimeters, it will typically pass on its own. A stone can take up to 6 weeks to pass before you have to worry about kidney damage.
Wow. All right. Well, thank you so much for joining us, Dr. Woolums. Great to see you again. And if you need any more information, you can just head to our website, WSAZ.com. Make sure you click on the Moms Everyday tab. You'll be able to watch this interview again and download our Moms Everyday app. We'll be right back with more Moms Everyday after the break.